Hi, my name is Martina and I work for the Health and Social Care Board in social care working in CAMS.
Hi, I'm Naomi and I'm a youth advisor for CAMS.
We're going to have a conversation today about the importance of communication and information for young people coming into CAMS. Naomi, thank you very much for coming to chat to me today. We're just going to have a conversation about CAMS and your journey within CAMS. Do you want to tell us a wee bit about your journey?
Yes, so my journey with CAMS began in 2012 when I was 14. At the beginning of my journey, I didn't realise that I had a mental illness or that I needed help. However, I was diagnosed with anorexia nervosa, anxiety and depression. At the beginning of my treatment, I was very dismissive of any help I was being offered by mental health professionals. However, now I'm so grateful for all of the help I was given because it really did help to save my life. Recovery was a really long journey. It was unpredictable, it had ups and downs, but thankfully I made a gradual improvement and was able to be discharged from eating disorder services when I turned 18 in 2016. Now I'm doing really well. I have learnt a lot from my mental health experience. It's not that I don't ever find things difficult or anything, but I'm very aware of my mental health and when I maybe need a little bit more support than usual. However, in general, I'm doing really well, happy, healthy and enjoying life, which are things that I'm so grateful and thankful to be able to say now.
Naomi, as you know, there are misconceptions about CAMS in the public domain. I'd just be interested in your view on this and if there are any messages that you would like to convey about CAMS.
Yeah, so in terms of mental health, it can be quite a taboo topic and there can be a lot of stigma associated with it, unfortunately. As someone who learnt so much about my mental health during my teenage years, I think a really important message is that talking openly about mental health is actually good. I often compare mental health to physical health, so while someone who has a physical condition, it may affect their heart, someone who has a mental health condition, it affects their brain, and both the brain and heart are both organs of our body. So really never feel embarrassed or ashamed when talking about mental health, because hopefully the more mental health is talked about in everyday conversation, the less stigma will be associated with it.
That's a fantastic analogy. One of the reasons, as you know, why we're here today is to launch the new Working Together Care Pathway. I'm just wondering, what do you think that has to offer young people coming into CAMS?
I think the new Working Together Care Pathway is brilliant. It offers such detailed information about CAMS services, including the values of the care pathway, the principles of CAMS and the steps of care offered by CAMS, and ultimately it highlights the importance of working together, both as a team with young people and their families to help the young people get better, which is something that is so important, and also as a team of professionals helping the young people get better.
Naomi, you were personally involved in the Welcome to CAMS, a guide for you, which we are most grateful for. But can you tell us why it was important for you to be involved in that product?
This was one of the first projects that I was involved in when I became a youth advisor in early 2017, and I was really excited to have the opportunity to be involved in this project, because ultimately the guide is to help young people and their families get through their CAMS journey. And as someone who had recently been discharged from CAMS services, I knew I had a lot to offer in developing this guide coming from a young person's point of view.
Why do you believe your involvement and the involvement of the other young people in the guide, why did you believe that was important?
The really important thing about having young people, the other youth advisors and myself having input into the guide is that we all have personal experience of going through CAMS as a service user. So we were all able to draw from our own experiences to be able to say what would be helpful or unhelpful in a guide like this, and also help to make sure that the language used in the guide was young person friendly, and these are some of the factors that were key in hopefully making this guide a success.
What does the guide offer young people and their families?
The guide gives such a concise outline of what to expect at every stage of the CAMHS journey, and this is something that I think could really help both young people and their families throughout their CAMHS journey. And I really hope also it'll make their experience seem less daunting and also help them engage with the services that they're being offered.
Are you proud of what you achieved?
I'm really pleased with the finished document. It's so rewarding to know that my input of the development of this document could really help both young people and their family throughout their CAMHS journeys. Whether they are starting their journey or nearing the end, this document covers every aspect of what to expect, and I think that this is something that could really, really help young people and their families.
What would be the one key message that you would give young people coming into CAMHS today?
Something that I would love more young people to hear and understand is that getting treatment for a mental illness or a mental health problem isn't anything to be ashamed of, and while recovery is so tough, there really is hope for a better future free from the illness if you keep fighting the illness and listening to the people who want to help you. So,
any plans to do any more of this type of work with the Health and Social Care Board, which we're hoping you say yes?
Well, I'm still working as a youth advisor with CAMHS, so I hope there'll be more opportunities to do work like this. My role as a youth advisor has really evolved over the past year. I've been involved in so many projects covering a wide range of areas, so I'm really excited to see the opportunities that will come with the role in the future.